Live breaking news. We're coming to you from the School of Nursing, where we have an exclusive interview with Ms. Bonnie Webster on the mysterious role of what is an informatics nurse. Now to you, Alisha.
Hi, Ms. Webster. I'm Alisha, and I'm going to be doing an interview on you about informatics nursing. So I'm going to ask you some questions. First question is, what do informatics nurses do?
Okay, well, thank you. Nice to meet you, Alisha. Informatics nursing. Informatics nurses, they can work in a variety of places, such as the hospital, where we interface between the users of the systems as well as the program developers. We want to make sure that the users know how to use the system and that it does what that it's supposed to do or what they want it to do to provide good patient care. We can also work with companies in vendor worlds and do demonstrations and do product designs, and we can also work in education and in research and in nursing administration.
Okay. My next question is, how long have you been an informatics nurse?
Oh, that's a good question. I have been a nursing informaticist probably since 1990, so that has been 22 years. Thank you. That's a long time.
Great. My next question is, what makes an informatics nurse different from a med-surg nurse?
Good question. To be a good informatics nurse, you have to be a good bedside nurse. So being a good med-surg nurse, you have to know what it is that nurses do to help provide patient care, what physicians do, what respiratory care therapy does, and know what patient care is and what it's involved. So you take that skill and then you develop and use that skill to develop systems that can assist nurses to provide that care.
Next question, what is the importance of an informatics nurse?
The importance, okay. The importance of a nursing informatics person or a nursing informaticist is to be that liaison between the people who actually develop code and think that a system will work and us, the end users, the providers of patient care. We are the ones that go between and say, okay, the developers think it should work like this, but the end users want it to work a little bit different. Where can the compromise be? And what can we do? We, as nursing informaticists, know just enough about the technical side to be able to know if something is possible, and we then help the programmers and developers to know something about the patient care.
And just from the benefits that you've mentioned, it sounds like it is a benefit overall for the hospital. So my next question was, what is the benefit for the hospital specifically?
Okay, good question. The nursing informaticists and the members of the team, because the nursing person works as the liaison on the team of the people actually doing the implementation for project management. We can look at a system and know how it's going to work for the patient and for the nurse providing the care for that patient, and the physician and the pharmacist and what so. And so maybe we can build the system at the beginning and see if we can troubleshoot some problems as they're being developed versus getting it out there where everybody is and using it and then having to revise it and redo. It's much easier to fix before you implement.
And what led you into the profession of becoming an informatics nurse?
Back in those days, which hasn't been really that long ago, there was not a certification or a specialty of nursing informatics. It was something that, okay, we're going to develop a system, we need some people to come help and work on it, we need some people that have been involved in nursing for a while that know patient care. I think you'll be a good person once you come work on our project with us. So that's how many of us that have been doing it for a little while actually got started, was by trial and error, learning on the job. Then we became more skilled at knowing what a project was, knowing how to go through the steps of project implementation, knowing how to build database and how to use the computers. So how do you get into it? You volunteer, you be the super user when something is being implemented, when there is a project or a new initiative in the hospital and they're asking for people to get involved. Raise your hand and say, I'll help. Even if you don't change your career path, you still can be involved from that end user standpoint and become the super user or just even the good user on the floor that can help the other staff on the floor.
Going along with that, so what does someone need to do to become certified?
To become certified, you have to be practicing in the field because you're going to need 1,080 hours of clinical nursing informatics time that you document. You have to have so many continuing education units that's primarily in nursing informatics. You just have to have a will and a desire to do that, and then you have to go take a test.
Okay.
And you have to pass the test, and you have to pay money, and you have to pay money every so often
To renew.
to renew.
Okay.
Yes. Uh-huh.
And if I was wanting to become an informatics nurse, where would I go to? What website or resource would I go to?
Oh, good question there too. The certification board. ANCC, the American Nurse Credentialing Center, is where all of the certifications are listed, and nursing informatics is one, and it gives you all of the criterion that one needs to meet and what you need to study to take the test in order to do that. But you probably want to get a job or be involved in your job doing that type of work, because then you'll be able to answer the questions and be able to study and relate it to what you're doing.
Okay. And for my last question, I'm sure the question that's on everybody's mind, how much more money do informatics nurses make?
Oh, nursing informaticists, because we are in demand, there are not a lot of jobs. Well, there are a lot of jobs. There's just not a lot of us to fill those jobs. So the salary is pretty good. If you were to go around and be a consulting, which is another role, by the way, of what a nursing informaticist can do, you can go to other hospitals and you can help them build their systems and travel across the country. You can either work for that hospital or you can work for the vendor to help them, the hospital, implement. Those nurses make a lot of money. You travel a lot. You usually leave on a Sunday night, come back on a Thursday, maybe a Friday. You can pull in up to 120, 130 just starting out, $1,000 a year to do that. Now, in my position working in education, unfortunately, the benefits are not there. But when you do vendors, working with vendors, or even in the hospital setting, because it is such a defined role, the competition to get that person to come to you, you have to incentivize them quite a bit to come.
Okay. Okay. Well, thank you so much for your time. I appreciate it.
You're welcome. I appreciate it as well.
Thank you, Alisha. Now we can all sleep better at night knowing what is the role of an informatics nurse. And action.
Go. Just start off.
All right, guys, we're done.
Is that a wrap?
That's a wrap.